definitely is important because we have several layers who have different actions that would contribute to the reduction of our lymphedematous lower extremity or upper extremity. What I find good about the multi-layer bandaging is, number one, we're able to achieve the conical shape, especially for patients with asymmetric lower extremity or upper extremity. That's achieved by doing the multi-layer bandaging. Number two, of course, not all bandaging are created equal, or the techniques are not created equal. So a multi-layer bandage assures patients that even if there are certain loose ends, there is still some compression that will be helpful to achieve a reduced lower extremity or upper extremity with lymphedema.
In managing patients with lymphedema, it is very important to make use of the multi-layer bandaging, especially if you're dealing with advanced cases or stage 2 to 3 lymphedema. This typically consists of the use of stockinettes, synthetic padding, and short-size bandage or elastic wraps. And each of these layers have specific function to promote an effective means of managing lymphedema.
Here in the Philippines, we are a very resource depleted country when it comes to lymphedema care. And we have seen patients using uh, the available long stretch bandages, which is not what is normally used for lymphedema. So when we are able to share with them our short stretch bandages, they can really see a difference with how their lymphedematous extremities get reduced. And they have a better understanding of the physiology of why we use short stretch bandages versus those commonly seen in our pharmacy or in other hospitals. So what short stretch bandages give us is the physiology wherein we are able to reduce the size of the lymphedematous extremity, and at the same time, we are guaranteed that if the patient ambulates or exercises with our short stretch bandages, number one, we are still able to maintain the shape of our lower extremity, and number two, it actually helps in further reducing the girth of the lymphedematous extremities. And with short stretch bandages, especially with Roxadel K, it's more available in our country, and the more and more patients are able to get for themselves, and it's very easy to use compared to other long stretch bandages.
Please note that the short stretch bandage has a high working pressure, especially if the muscles contract, and a low resting pressure, unlike the long stretch bandage, which is not good for patients with lymphedema because it has some tourniquet effects even during resting.
And so definitely it's a big yes. Of course, when it comes to lymphedema, other etiologies of lymphedema such as venous insufficiency, compression is still the cornerstone therapy for these conditions. So yes, we do see drastic improvements with the use of compression garment, and we can actually get our patient experience that they themselves not only report better looking lower extremities, but of course, better mobility.
Definitely, compression therapy is beneficial in managing patients with lymphedema if done properly, making use of the correct material, correct garments, and the proper technique. And of course, this has to be complemented with the other three cornerstone of therapy, which are skincare, manual lymphatic drainage, and exercises. We also have to remember that the key to effective management of lymphedema is still early detection. So if you have symptoms of lymphedema, please go to your nearest doctor for advice and proper management. Thank you.
People, health,